Hi, my name is Brooklyn,
My name is Abby.
and we work at Cardia Vision, and we're here to share some of the things we've learned working here.
One thing that I didn't know previously was that a coronary calcium score of 0 does not necessarily mean that you don't have heart disease. So we looked at the first 100 patients at Cardia Vision in 2024, and we found that 69.8% of those who had a calcium score of 0 still had soft plaque present in their coronary arteries.
It's also crazy learning that sometimes people can have a healthy lifestyle but still have heart disease. It's kind of like what you're saying.
Yeah.
But I know recently we had a patient who was in his 40s and he had run about like 10 to 20 miles on a weekend, which is very impressive. And he had a calcium score of 0, but he still had an 80% stenosis of his widowmaker.
Yeah, the widowmaker that you may have heard of is actually the left anterior descending artery in your heart. And the soft plaque is actually more vulnerable than calcified plaque, which is what a calcium score study detects. So the way to see that soft plaque is with a coronary CT angiogram.
The good news is, if you catch it early, dangerous soft plaque can be eliminated with PCSK9 inhibitors and high-dose statins. Do you want to explain what those are?
Yeah, so statins are probably the most traditional approach towards treating atherosclerosis of the coronary arteries. And the LOCATE trial found that high-dose statins can calcify and eliminate soft plaque over time. But the problem that a lot of patients have with those statins is that they can sometimes cause muscle and joint pain. So there's a newer medication called PCSK9 inhibitors, which includes Repatha. And those have very little side effects, and they do the same thing of eliminating that soft plaque, which is the goal. And the cost of Repatha has actually just recently come down. So with a coupon on GoodRx, you can get it for only $239 a month. So it's becoming a lot more accessible option.
Abby, what do you think would be a good indicator that you should get a CCTA?
So we recommend anyone that has risk factors, which could include a family history of heart disease, high cholesterol, diabetes, gum disease, working as a first responder, things like that, to get it for men at 40 and women at 50. And if you don't have any risk factors at all, we still recommend you get it, but 10 years later. So that would be age 50 for men and age 60 for women.
What if I am learning all this and I want a CCTA scan? Do I need my doctor's approval? Do they have to write a referral to Dr. B?
Yeah, great question. So there is no referral needed to get a coronary CT angiogram here at Cardia Vision. If you have risk factors or if you're concerned that you might have coronary artery disease, just give us a call. We can take a look, see if there's any plaque in there. And there's a lot more information on our website as well, cardiavision.com. So if you want to learn more about what a coronary CT angiogram can see and how heart disease can be treated, you can find that information there.